Hello everyone, welcome to this tutorial, and in this tutorial we'll be talking about ASCARIS lumbricoides, which is just a continuation of the intestinal nematode series that we've been doing, and specifically the soil transmitted nematodes. To start with, it is very important that you take note that ASCARIS lumbricoides actually is the largest intestinal nematode that parasitizes humans, and it is also commonly known as roundworm. Okay, so Ascaris lumbricoides is also known as roundworm. So this is how Ascaris lumbricoides looks like. This one represents the adult male, then this one represents the adult female. Talking about the habitat, the adult Ascaris worms actually primarily inhabit the jejunum, as well as the medial portion of the ileum, just within the small intestine. Then we come to the epidemiology. Okay, we come to the epidemiology. So Ascaris lumbricoides is actually a cosmopolitan parasite. Is a cosmopolitan parasite. This means that this Ascaris lumbricoides occurs globally. Okay, but it is it mainly affects tropical and the subtropical regions, such as India, for example. Then, when it comes to the most conducive environment for Ascaris lumbricoides, clay soils. Clay soils happen to provide the most conducive environment. Okay, they provide the most conducive environment for the development of Ascaris eggs, because in comparison to hookworm eggs, the hookworm eggs um, are provided with a conducive environment in moist and porous soils. Then talking about risk factors, um, children, okay, children, especially those who are under the age of 5, okay, especially those who are under the age of 5, including school aged children, or school going children, as well as malnourished. Those who are malnourished, these ones are the most um, important disseminators of this of the disease that is caused by Ascaris lumbricoides. Then, coming to the eggs of Ascaris lumbricoides, the female worms actually get to release two types of eggs. We have fertilized and those which are unfertilized. But it is of great importance that we understand that okay, only those eggs which are actually fertilized are the ones which are able to undergo full development and become effective. Then, when it comes to the larva aspect, the the larva development of Ascaris, it proceeds through four main stages, which are identified as L1 to L4. Okay, so this is very important. A few individuals don't really take note of this. Okay, but it is of great importance to show that you really understand this particular um, topic of this parasite, which is Ascaris lumbricoides. Then we come to the most important and a bit involving part, which has to do with the life cycle. Okay, so let's talk about the life cycle of Ascaris lumbricoides. So, talking about the life cycle, as you can see on this very slide, there are various various aspects. Okay, but to start with, it is of great importance that you realize and understand that when it comes to Ascaris lumbricoides, the definitive or the host of this particular parasite involves only one definitive host, which is man or humans. Okay, then the infective stage of this life cycle has to do with embryonated eggs. So those embryonated eggs, for them to be considered as the effective stage, they should contain the L2 larvae. L2 larvae. Remember, we said that the larva has four stages. We have L1, L2, L3, and L4. So L2, when L2 larva is contained in embryonated eggs, those particular eggs will be considered to be infective. Okay. Then when it comes to the mode of transmission, um, is ingestion, okay, ingestion of embryonated eggs from contaminated soil. It can be contaminated food, or it can be contaminated water. Okay, but now when talking about this life cycle can be grouped or categorized into two main parts. We have the migratory phase. Okay, we have the migratory phase. Okay, and we also have um, uh, from the migratory phase, we also have the intestinal phase. So we'll start with uh, the migratory phase. Okay, we start with the migratory phase from the word migration. Okay, so we're talking about how these eggs, after they have been ingested or swallowed, they move from point A to point B. Okay, so now with this our cycle, we are going to start with our migratory phase. We're going to start it from ingestion. Okay, we're going to start it from here. So this will be considered um, as our first step or our first part. Okay, on ingestion of embryonated eggs. Okay, this is where we're starting from. So now, embryonated eggs, you find that they are ingested by the host, as you can see here. Okay, they'll be ingested by the host. Now, when these have been ingested, okay, when they have been ingested, what will happen is that um, the eggs will then proceed and hatch in the duodenum. Okay, they'll proceed and hatch in the duodenum. Okay, they'll proceed and hatch where? In the duodenum. Now, when they hatch in the duodenum, they'll release the L2 larvae. Okay, then the L2 larvae will actually molt once. So when they molt once, you'll find that they will penetrate the intestinal wall. And once they penetrate the intestinal wall, what they'll do is that they'll travel via the portal circulation. So when they travel via the portal circulation, they will go to the right side of the heart, and eventually they will reach the lungs. Okay? Then what will happen is that within 6 to somewhere 10 days in the lungs, they will mature. Okay? They will do what? They will mature. Okay? They will mature, and that maturation that is going to occur is they'll mature into L4 stage. Okay, then once that has occurred, you'll find that the larva will then break into the alveoli. Okay, the larva will then break where? Into the alveoli. And when it breaks into the alveoli, what will happen is that they'll ascend through the bronchi, through the trachea, and the pharynx, and then are subsequently swallowed back into the gastrointestinal tract. Okay, so that which I'm from explaining falls under the migratory phase. Okay, then we have what we call the intestinal phase. Okay, we have what we call the intestinal phase. Okay, so you find that the migratory includes all these parts here. But now, so let's focus on the intestinal phase. So under the intestinal phase, okay, under the intestinal phase, after re-entering the small intestine, the larva will undergo their final molt and develop into adult worms. Okay, they'll develop into adult worms. Okay, now these are the adult worms. Okay, these are the what? These are the adult worms. Okay, they've developed into adult worms here. Okay, so what will happen is that the adult worms will reach what we call sexual maturity. And when they reach sexual maturity, the females will begin to lay eggs. But remember, we already said that these females can lay either uh, um, fertilized or unfertilized eggs. Okay, so they'll begin to lay eggs which are passed out in feces. Okay, you've seen, so which are now passed where? Passed out in feces, like that. Okay, which are passed out in feces. Okay, so what will happen is that since now these worms are these eggs have been passed out in feces, what will occur is that in some cases, as you can see here, we have two kinds of eggs. Okay, we have fertilized eggs, and in some cases unfertilized eggs are also done what? Are also laid even before mating. Okay, so these eggs are laid even before mating, but what will happen is that they do not develop further. Okay, they do not undergo further development. Okay, what will happen is that it is these fertilized eggs now which are going to become embryonated. Okay, they'll become embryonated within 10 to 14 days. So this embryonation occurs. Okay, uh this embryonation actually occurs 10 to 14 days under optimal conditions, such as warm temperatures of approximately about 22 to 30 degrees Celsius, clay soil, as well as 40% humidity. Okay, so it is of great importance to also mention that during the adult stage in the intestine, as well as the fertilized egg, as well as uh, the unfertilized egg, those stages can be considered as the diagnostic stage. Okay, diagnostic stage. Okay, then inside these eggs, okay, inside these fertilized eggs, we have what we call the L1. Okay, the L1, which is known as the rhabditiform, rhabditiform larvae, which is L1. So L1 will then develop first. Okay, will develop first, as you can see now. And when L1 has developed, what will happen is that it will molt into L2. Okay, into L2, and then like that, the cycle continues. Okay, so that those are some of the key important things that you need to know on the life cycle of Ascaris lumbricoides. Now let's talk about the pathogenesis and clinical features of this particular parasite. So this particular parasite causes a disease known uh, ascariasis. Okay, ascariasis. Okay, now we have symptoms. We have symptoms which are as a result of migrating larvae. Okay, remember we have the migrating stage as well as a migrating phase, as well as the intestinal phase. Okay, so firstly we'll talk about symptoms which are due to migrating larvae. Okay, so during the larva migration, okay, during the larva migration, the host actually may exhibit hypersensitivity reactions, which include allergic manifestations such as urticaria. So urticaria, we're talking about skin rashes, swollen lips, as well as asthma-like attacks. Okay. Then we also have during the same migrating larva stage or phase, we have what we call Loflazy's syndrome. So Loflazy's syndrome is characterized by ascaris-related pneumonia. We also have increased eosinophils in the blood, as well as abnormal thoracic X-ray findings. Okay, so these typically shows fleeting pulmonary infiltrates. Then continuing with pathogenesis and clinical features, we have symptoms which are as a result of the adult worm. Okay, so it is of great importance that you take note that most infected individuals who are infected with this particular parasite, they remain asymptomatic. But then in symptomatic cases, adult worms can actually cause malnutrition and stunted growth, especially in children. Okay, why? It is because this parasite or this worm actually tends to compete for nutrients with the host. Okay, again, this same adult worm can cause gastrointestinal disturbances such as acute abdominal pain or discomfort. Then we also have extra intestinal complications. So extra intestinal complications may include biliary colic. Okay, biliary colic. So this biliary colic is caused by migration into the bile ducts, migration of the parasite into the bile ducts. We also have cholecystis, okay, cholecystitis. Okay, so this cholecystitis is actually the inflammation of the gallbladder. Then we also have pancreatitis, and we also have respiratory obstruction, particularly if the worms tend to migrate upwards. Then when it comes to laboratory diagnosis, okay, laboratory diagnosis, we can talk about egg detection. Okay, so in order for us to detect the eggs of Ascaris lumbricoides, we can talk about microscopic examination of stool samples. Okay, so stool samples actually remains the gold standard for identifying Ascaris eggs. Then when it comes to adult worm detection, okay, when it comes to adult worm detection, imaging techniques actually such as X-rays, ultrasound, or barium meal radiography of the gastrointestinal tract may help us visualize adult worms. Then we also have larva detection. Okay, so the larval stages may be found in sputum, okay, or in gastric aspirates. This is especially the larval detection in sputum or gastric aspirates can be very helpful during the migratory pulmonary phase. Then we also have serological tests which have to do with antibody detection. So methods such as ELISA, um, indirect fluorescent antibody test, as well as indirect hemato indirect hemagglutination assay are very much useful when stool results are inconclusive or in the extra-intestinal cases. Then when it comes to treatment, so the first line drugs, okay, the first line drugs of this particular parasite or infection has to do with albendazole, 400 milligrams, taken as a single dose, okay, or we can have mebendazole. So these ones are equally effective, okay. Then alternative treatment options include ivermectin as well as um, nitaxoanide, okay, nitaxoanide, particularly in cases of resistance or mixed infections. But these ones, okay, albendazole as well as mebendazole are the first choice. Then we have special consideration, okay? We have a special consideration. So this special consideration has to do with in terms of pregnancy, okay? So in pregnant women, pyrantel pamoate is considered safe and effective. Then when it comes to the prevention, okay, so prevention of Ascaris lumbricoides actually follows the same public health measures as those used for other soil transmitted helminths, for example, hookworms and Trichuris tricura, okay. But most of the key strategies include improved sanitation and hygiene, especially in rural and endemic regions. We also have proper disposal of human feces to prevent soil contamination, washing hands with soap before eating and after using the toilet, and also thorough washing of fruits and vegetables, especially those which are grown close to the ground. For example, when we talk of cabbage, cabbage is one of the key factor when we are talking about vegetables. It is at high risk of containing this parasite. And also health education. Okay, so this health education comes in order to raise awareness among communities, particularly among parents and caregivers of children. This is where we end for this tutorial. Thank you very much for your attention.